Good morning, everyone.
Morning, sir.
Good to see you this morning here on Saturday. All right, please high five your friend next to you and say good morning.
Morning.
All right, high five someone then opposite you and say good morning. The other way, the other way.
Morning. Okay, alright.
All right, welcome to Basic Infant First Aid and CPR Training course. My name is Dr. Jeremy and I'm glad to see you all here this morning on a Saturday morning. Are you ready? If you say yes.
Yes.
Can you hear you louder bit? Say yes.
Yes.
All right. Okay. Yes, welcome everyone. I just introduced myself. My name is Dr. Jeremy. I am a medical doctor by profession and I call myself a family medicine consultant because I'm actually doing my specialist in family medicine. Yeah, what is family medicine? That means we actually do a lot of prevention and out of medical care outside the hospital. Yeah, and personally, I have almost about 12 years of medical knowledge. Yeah, and I know I look quite young, I know, yeah, but then with all the experience comes what I'm going to teach you today. So for me, one of my life passion and my life purpose is I really want to teach more people first aid and how to save a life because it's very important. If we can help people, although we're not medical staff, but a little bit of help can go a long way. And to me, my passion is to teach all Malaysians to do first aid and also such thing as CPR and how to use the AD training. But today, for this course, we'll be talking specifically about infants and babies. Alright, and that's why you're here today. But before that, before I will go into the course, let's do a little house rules. Okay, for all your phones, alright, make sure you keep silent. Alright, keep silent. Kalau if you have to take a call, yes, you can excuse and have a call. We will have a toilet break later. Alright, number 2 is the very interactive sessions because I believe the best way to learn is you have to be interactive and hands-on. If I just stand here and I just talk to you and just listen, I can tell you less than 30% goes in. But if you do hands-on and you practice, you can retain easily up to 70 to 80% of your knowledge. And that is what we want in life saving. Because when you save a life, we all here, but you cannot practice how you save a life. You must be able to do it. Everyone say, do it!
Do it!
Very good. Alright. And last but not least, if you have any questions, please hands up and stop me on the spot. Alright, and I will take your answers and anything I can help you. But any questions along the course, and there's any words you see is too big, too medical, you don't understand, of course I'll use simple English. But if you have any words that you don't understand, please let me know, stop me, and then I'll answer your question. I'll help you to make sure no confusion before we proceed to the next point. Is that good?
Good.
Alright, we're good. Give me a thumbs up. Alright, let's to begin. Alright, so what is the learning outcomes for today? So by the end of the session, we're going to be able to do this. Alright, let's do some reading for me. Billy, yes, can you stand up and read the number 1?
Identify common infant medical emergencies and injuries.
Very good. We have Nazra, number 2.
Apply appropriate first aid steps confidently and calmly during emergency.
Very good. Sufika. Fika, right? Fika, number 3.
Correct choking relief techniques for infants.
Right, and Mr. Is. Number 4.
Demonstrate correct CPR techniques for infants.
Very good. So by the end of this training, this goal of this training is for you to be able to have all these outcomes and be able to face all these different first aids, how to have proper choking relief techniques and also good CPR, especially for infants. Okay? So the learning modules we'll go through are these 4. Firstly, I'll do introduction to infant first aid, and then we follow by basic infant first aid, choking in infants, and last but not least, CPR in infants. CPR, okay? So let's do an icebreaker before we begin, because early morning, we have to wake up, some of you have coffee, but then please do this, alright? Please introduce your name, your profession, what do you do? Maybe share a bit about your family and children, no need too much details, but maybe if you have children, how many children, are you married, are you single, alright? And how old are your children? And please share with us your favorite moment with your children. Alright? Never mind. Let me give you an example. Let me start first. My name is Dr. Jeremy. I'm a medical doctor by profession. I'm married. Yes, I have 2 children. one girl and one boy, one 5 years old and one 3 years old. The 3 years old boy very naughty. Yeah, boys are. Okay. And the favorite moment I have with them is recently, because it was my wife's birthday recently, so we went and enjoy a little party together. Yeah, and they got cake, and then they have a great fun at the playground as well. So that was my favorite moment. All right, let's start with Billy.
Nama saya Billy Binti Swimin. Saya adalah supervisor housekeeping di Warisan Square. Saya ada 2 orang anak dan 8 orang cucu.
Wow.
Saya grandma sudah. Favorite moment bila bersama-sama keluarga lah, pergi outing. Dengan cucu sekali lagi.
What's your favorite outing?
Di mandi-mandi di sungai.
Oh, you're very good. All right, everyone, let's say hi, Billy.
Hi, Billy.
All right, okay, next.
Nama saya Najwa. Tapi orang panggil saya Najwa. Saya account assistant di Big Flat. Saya masih single, belum kahwin. Tapi saya ada anak buah. Saya ada 1 orang anak buah.
How old?
1 tahun setengah.
Okay.
So saya punya favorite moment dengan dia, every time saya balik kerja, di pintu dia akan panggil saya ibu, dia mau begitu.
Wow.
Lepas tu kalau saya mau tidur, dia lambat tidur, dia akan ketuk pintu, dia akan panggil, suruh saya keluar main sama dia. Itulah saya punya favorite moment dengan dia.
The everyday moments. Okay.
Yeah.
Everyone say hi, Najwa. 1, 2, 3. Okay, very good. Next.
Hai, nama saya Nursifika, tapi dengan panggil Mika. Posisi saya di sini Assistant Operation and Marketing. Saya masih single, belum lagi kahwin, tapi saya ada 20 anak buah.
20, 20.
Ya.
Wow.
And sekarang saya sudah ada title nenek lah, so saya ada cucu.
Oh, same like Billy.
My favorite moment bonding dengan anak buah lah, sebab mostly anak buah saya umur lebih kurang, so suka shopping and then makan dengan orang lah. My favorite moment.
Also a very day-to-day thing. Alright, okay, everyone say hi, Vika.
Hi, Vika.
Try one more time lah, semangat sikit lah. 1, 2, 3.
Hi, Vika.
Alright, that's very good. Okay, next.
Hai, nama saya Muhammad Iz. Saya bekerja di Warisan Square Technician. Saya masih single, belum kawin lagi. Momen dengan keluarga sejarah adalah anak-anak belum ada momen lagi.
Okay.
Biasa pergi outing sebenarnya.
Alright. Do you have siblings, brothers, sisters?
Ya,
How many?
4, 5, sorry.
4 or 5?
5 of them.
5 of them. And you are number? Number 1. So when you were young, you also spend time with them, right?
Most of the time.
Most of the time. Oh, okay. Alright, say hi, Is.
Hi.
Very good. Okay, last but not least.
Oh,
Mr. Handsome here.
Good morning, my name is Justin. I am the operation manager for Plan. I have 1 wife, 5 children. My favorite moment with my children, there's so many, but there's one. There was a period before I joined Plan. I was jobless for 1 month. So that time my wife was very busy doing MBA business. So I took care of my children, and we call it daddy's daycare. So from morning until night, they were with me. And in that 1 month, I was getting a bit worried. No more money, right? No job. Then my son, the 3rd boy, Jessel. So I put them for a nap together. All 4 of them. At that time, there were 5 of them, just 4 of them. Then Jessel will hug me, and I remember he told me this. You know, Daddy, you're my favorite friend in the world. And today I cannot forget that. Even though he's also very naughty, but that memory is still glued.
Yeah. Wow, thank you. Thank you for the vulnerable moment. You remember us about family. Alright, let's say hi, Justin.
Hi, Justin.
Yeah, so we see now how important family is to us. Of course, all our family members, they were once, whether even ada anak buah, cucu, even siblings, brothers, they were all once small, they were once babies, and of course, now that they're all grown up, they're a bit more hardy, they're a bit more strong. But imagine if really at a time something happened, then you might not have this kind of lovely moments. Alright, so that's why first aid and CPR is so important, especially when they are babies and when they are infants. Okay? So we go to the first module, we'll talk about introduction to this course. What is infant emergencies and what is infant first aid? So firstly, what is an infant? Alright, so today, for the purpose of this training, we will define an infant as below 1 year old, or 1 year of age. 1 year of age, that means it could be babies, it also could be a bit bigger, and even like 11 months old, 1 year old. What are you doing at 1 year old? Trying to walk, trying to walk, trying to crawl, trying to eat things, put everything in the mouth. Yeah, this is, we're talking about 1 year of age. Alright, so today's emergencies and first aid will be mainly to these age groups. Yeah, I'm sure some of your children or some of your brothers, sisters were previously one at this age. So maybe you can imagine a little bit. Now maybe go into the scenarios. Okay, why? Why do you have first aid? Why is so important? Yeah, like just now you mentioned, you are a very loving family. You know, you have a father, mother, you know, either yourself, you have your children. Of course, sometimes very hard to expect, very hard to estimate. Emergencies happen, disaster can happen, and if everything doesn't go well, of course you end up with a very sad family. Maybe they're still alive in the hospital, but then of course through a very troubling time. But of course, what happens if there is, we can do first aid, or we can help the situation. Yeah, where previously maybe it can end up very bad, but then with first aid, you might be able to restore them back into a happy family. So that's why knowing very basic first aid, especially for infants and babies, are so important, because they are their most important, vulnerable moment, their most fragile moment, and that's how we can actually help them. Alright, so just now we talked about the why of first aid. So now let me talk about the what, the when, the where, and how. Alright, so why we need to do first aid? Tadi sudah cakapkan, you mentioned that to save the life and become back family yang happy. Alright, so what is first aid? Is medical attention that is administered immediately. So what is the word that is the most stand out to you here? Everyone say again. 1, 2, 3.
Immediately.
One more time. 1, 2, 3. Immediately. Right. First aid. Because as even you're non-medical, you're there next to the baby, you can do something to help the situation immediately. When do we do it? Alright, together. 1, 2, 3.
Right
after the injury occurs. Immediately right after. Where? Di mana? At the location. That means, let's say if you're at the home, when do you do the first aid? At the home. If you're in the office, when do you do the first aid? In the office. If you're outside, next to the road, next to the center point, when do you do the first aid? It's there, right there. Okay? Or around the area. Okay, so that's first aid. And how do you do it? Jeng, jeng, jeng. Stay tuned. Okay? We will teach throughout the training. Alright? So now, maybe we're going to do a little activity. We're going to do a little group discussion. Okay? So, here we got 1, 2, 3, 4, 5. Okay, maybe Billy and Nasra, you can pair together in one team. Justin, Itz, and also Fika, you can pair as one team. Alright? And then you discuss. I give you 2 minutes. You discuss and you tell us and share to the room what are the most common infant emergencies that you can think of. Alright? 2 minutes, Start now.
For me, drowning.
Choking.
Choking, drowning. What else? Falling, yes. Falling. Missing. So, choking. Okay. So Fika, you present again. But,
Boleh.
Oh, done, Lee. This
Done,
team
ready.
ready, Lee.
Ready.
Ah, so fast. Okay, very good. How about this team? Are you ready? Ready. Alright, very good. Okay, who want to go first? Who present? Fika present, eh? Who present here? Nazwa. Okay, stand up lah. You want to use each other. One round. Siapa yang menang pergi dulu. Okay, Fika. Alright, Fika, please stand up. Come to the front. And maybe you let us know what are the most common emergencies that your group discussed. Alright, everyone give Fika a round of applause.
When we discuss the most common internet emergency is choking, falling, and drowning.
Choking, falling, and drowning. Okay, very good. So out of these three, which you think is more common? Most common, you feel?
I think falling.
Falling.
Yes.
Fall from where?
From the bed.
Fall from your bed. Oh, because your 20 anak buah selalu begitu.
Yeah.
no, you're not placing the bed.
Come from experience. Alright, okay, give Rafika a round of applause. Alright, that's right.
Keep it short. Start talking and stop.
It's okay, can. Go ahead, Najwa. What is the most common infant emergencies?
The most common infant emergency itu kain punya room. Yang pertama kain tinggi dan sedikit.
Choking,
Kedua ada macam terpegang benda-benda yang tajam.
okay.
Ketiga ada tergelincir ataupun terjatuh.
Okay, skip or falls. So choking,
Choking, pegang benda tajam.
sharp things, alright.
Tergelincir jatuh.
Oh, and falls. Alright, okay. Very good. Which among these three you think is the most common that happen?
Sikit.
Tercekik, choking.
Ya.
Ya.
Oh.
Sebab dengan dia menyusu sama ibu pun dia choking juga.
Okay, alright. Now let's have Justin. Okay, you do a bit of discussion. Justin, can please stand up?
Correct.
And maybe you can comment on Nazra. What do you think about these three emergencies? Is it common? Is it not so common? What do you think?
For me, they are common, but honestly, I've never come across anybody choking. I've never really, and I hope I will never also. Okay, but falling and sharp objects, yeah, I think that is very common.
Very common.
And for some reason, children never listen to the word no. Say
Ah.
no, that's what they do more. Yeah.
Yes. Alright, okay, thank you. Very
Okay,
good.
thank you.
Okay, maybe Naswa, maybe you can give some comments on Fika's 3 points. Just now Fika you mentioned what? Choking, falling, and drowning. Alright, Naswa, can you give comments? What do you think?
Okey, yang pertama apa tadi?
Choking.
Choking tu ya, saya pilih choking kan. Sebab sekarang pun banyak kes budak-budak yang tercekik. So member baru pun ada budak yang meninggal sebab tercekik di rambutan.
Rambutan?
Ya.
Oh, okay.
Lepas tu, ya ada sir.
Ada.
Ada di berita.
Berita.
Meninggal sebab dia punya parents tak tahu mau buat apa kan. Yang ada teknik hemorrhage tu pun dorang tak tahu buat itu. Jadi dorang bawa pergi hospital. Tak tahu diselamatkan.
Doktor orang kasih keluar 1 biji rambutan.
Dan kedua apa tadi?
Falling.
Falling. Itu pun saya rasa okey. Saya rasa common juga sebab ya saya punya anak buah pun kadang-kadang memanjat kerusi, memanjat meja.
Okay.
Okey.
Climb table and fall
Ya,
down.
ya.
Alright. Drowning.
Yang ini saya tak pasti. Sebab saya belum alami lagi dengan anak buah saya, jadi saya tak tahu.
Okay. Alright, thank you Nazra, thank you. So, common emergencies that you all mentioned just now, I think most of you, some of you mentioned which is more common than this scrub. Yeah, for example, like falling. If you have a child and they are like 6 months old, trying to crawl or sit down for the first time, or they're trying to walk when they're 1 years old, of course they're going to be falls. they're gonna be bumps. Yeah, but I think some of you also mentioned about choking, which is not very common, but it's very serious.
Yes.
Because like what Najwa said, it can actually take a life, boleh menyebabkan meninggal, and all these things. Alright? So let me just very quickly write it down. Okay, just now we talk about choking. Right. Tiga apa tadi tu? Falling.
Falling.
Alright. Drowning. Okay, Najwa? Choking.
Falling.
Sharp objects lah. If you hold sharp objects, then apa? Cut lah, cuts lah, cuts and bruise lah, bleeding lah, cuts and bleed lah. Okay. Another one is falling. Okay. So let me tell you that today's course, thankfully, will cover everything of this. But because I want to know which are you most interested in, so I want you to do survey. I want to do survey. I want to put a vote. Okay. So I give you the pen. Each one take one pen. I need to pass. Kasih pass the pen. Maybe another. Everyone take one pen. Okay. You can one by one you come up and then you think which one you want to learn more. Then I will focus more on this course. I will also go through the rest, but I will focus more on that one. Spend a little bit more time so you can learn a bit more. Alright? One person got 2 votes. One person can vote 2 times. Okay? So like Justin, let's say he vote choking and drowning. Sorry, tick, begitu. Alright, only 2 I don't see like 1, 2, 3, 4 I know because I can see the color
Oh.
Alright? Okay, come one by one. Let's start with Justin and then Willie, come up first.
It's pretty hard.
Yeah, go there. Okay, boleh. Yes. Alright, Justin, tukar tick.
Oh, yeah. Okay, this marker is gone. Nice.
Alright, thank you, Najwa. Ika.
Sorry.
Alright, this. Choking and drowning. Oh, cuts and bleed. Senang lah, just stop tadi lah.
Boleh bagi
Can also important first aid.
Yeah.
Stop the bleed. Okay, we also touch about this,
Yeah.
but then maybe very quickly just to go through. Drowning. I see there are two participants that are interested in drowning. Of course, we'll talk about drowning as well. But in general, let me tell you lah, the tip. If you're drowning, usually most of the time end up having to do CPR. Okay, so this actually means CPR. Okay, falling or number 2, got 3 people vote for it. So what do you do when they fall? The bumps. Yes, we will touch about this. And it looks like everyone is interested in how to do choking. Alright, so today I will focus on this module to make sure that they don't telan like rambutan and then they get issues. Okay, thank you everyone for saying. Give us a round of applause. Okay, very good. So as like one of you mentioned, very commonly we have these few issues lah. Okay, we have falls. Just now we mentioned falling. Okay, we have choking, which is also very common. How about burns?
Oh. Everything over there.
Yes, burns, quite common as well. Because when they're young, especially when they're below 1 years old, very curious. Then put the hand in go and just grab things like that, alright? And of course, fever and fits. For those who have kids, have you had a chance at no fever before? Sure got fever, right? Like anak buah, those who have nephew, nieces and things, is maybe yourself fever lah, or maybe your sibling got fever. If your kids got fever, can you sleep at night? No, you cannot. They also cannot sleep. You also cannot sleep. Alright? So we'll touch about on this one, on how do we go through with this. Okay? Alright, are you ready?
Ready.
Okay. So let's start about, first we talk about basic infant first aid. As mentioned, we'll talk about these 3. I'll first talk about fever, falls, and then burns, and then only we'll go into choking into module Alright, so let's start with fever. Alright, so what is fever? Let me ask, Billy, most experienced. Yeah. What is fever?
Demam yang demam panas, suhu badan yang tinggi yang tidak normal kan?
Okay. So like let's say your cucu anak buah feel hot kan?
Ya.
Then when you say oh this is fever or just dia warm only?
Kita boleh nampak daripada mata dia, air gitu.
Okay. Apa air?
Dia feel macam sejuk.
Okay. The chills. Yes. Alright.
Saya anggap dia fever lah.
Okay. Very good. Thank you for sharing. Give a round of applause. Okay. So in the medical, the fever is defined as 38 degrees. At home, everyone got a temperature gun. Got. Yes. Really?
Ada yang negatif.
Oh, there's still one.
Ya.
Okay. Nashwa ada temperature gun. Oh, di telinga. Okay, the ear. Okay, very good. Apa Fika? Don't have. But you got 20 anak buah.
Ya.
Maybe you need to buy one lah.
Ya.
Because very common. Fever. Oh, di sana. Pakai rasa. Then how you know fever? Agak sorry. Yeah. So by medical we need to know 38. So if below 38, sometimes we check 37.2. Is it considered fever? No. Warm. Yeah. But anything above 38, we medical we consider as fever. Okay. There are many causes of fever. Alright. So there are many reasons. For example, nowadays children, right, when they sometimes even below 1 years old, where do they go? The parents need to go to work, then the children go to kindergarten or daycare. And then what happens in daycare? Campur-campur, all the different children everywhere. And you know lah, now what season? Influenza season, cold season, virus season. Like a friend here, the voice a bit lari a bit. Yeah, so not only influenza, viruses. Yeah, so children because their immune is not so good, they will very easily get infected. So they go to school, they come back with a fever. They're like, oh my goodness, now as a parent, as a grandmother, or you have an anak boy, you have to handle them. Alright? So there's many causes. So how do you handle? How do you handle the fever? Okay, this one must ask all the more experienced is out of it lah. Maybe, but you can learn for next time. Yeah? Mantau ada rezeki, yeah, you got faith, can find a wife, you have kids as well. How many kids you want to have? What? How many kids? Anything?
They can count.
Anything is 11 11.
Football team.
Football team.
Okay, then.
Yes. Justin, how do you handle fever since you're daddy daycare for 1 month?
Very simple, dog. In a way, I'm quite lucky because my children, the moment they get fever, they become very weak.
Okay.
And very clingy. So and then the whole body gets very hot. Check. If it's 38 around there, I don't panic. Usually we have a paracetamol for all their ages really.
Okay, Panadol lah.
Panadol. So my elder 2 months, I'll give them Panadol. Panadol. The other 3, I give them the liquid lah, the syrup. The moment it goes higher than 38.5 like that, I get panicky lah, then I rush to the clinic. That is how we've been operating all this while.
Alright.
Yeah.
So Daddy Justin uses paracetamol syrup.
Yeah.
Okay. Other than that, any other ways to bring down the fever?
Kalau
Yes, Billy. Yes.
kalau macam dia punya panas terlampau tinggi, kalau saya pula kan, saya kasih mandi dia.
Okay.
Kasih mandi dia dengan air suhu biasa lah.
Okay.
Saya akan kasih mandi dia. Jangan kasih dia biar dia kena angin. Jangan tutup pakai selimut ke.
Kasih angin atau jangan kasih angin?
Jangan kasih angin, dia macam angin biasa lah, macam ni suhu bilik.
Okay. Alright. Okay. Yes. Okay. How about Nazwa and also Mika? No. Okay. Yeah, that's why you're here. That's training. Okay.
When fever comes, no problem.
No problem. Oh, yeah. You just think them and then parents, then you have to settle everything. Now very nice. Oh, happy. Oh, they cry. Okay, yeah. Yeah, I know. My kids also same thing. Alright. So what do you do? Okay, number one, like what Daddy Justin said, you can give Panadol. Okay, this is a syrup. But Panadol got two types. One is this way, one is this way.
Ya, ya.
Michael.
Masuk dari anak dia kan.
Yeah, yes.
Macam
Okay.
guru besar.
Yes, but depends. Some parents they don't dare to put up the bump, so they just give the syrup or the tablet, right? So if like what Daddy Justin is saying, they change name Daddy Justin. Right, if it's very high fever, usually we will use the one up the bump because it will bring down the fever faster, it will absorb faster, right? So we give Panadol up the bump. There is another one called medicine called diclofenac. Alright, it's a stronger medicine, but that one we don't give for children because that one can cause some side effect. We only give Panadol only for fever. Any other medicine we could try not to give. Alright? Other than antibiotic one. Alright? Then just now what Billy was saying is something called tepid sponging. Alright, so what is tepid sponging? Not only mandi, not only take bath, what we do is actually we take a cloth, yeah, and we wipe the body. Yeah, because when the body is hot, when you wipe, then it will take the heat away. Okay, but there is a very specific way to do it as well. Alright? So you use a cloth. What water do you use? Cold water or room temperature water or hot water? Warm water? Cool water? Room temperature water? Cool water?
I use that thing about that. Every small thing.
Oh, you don't use the yeah. But let's say you want to wipe, what water do you use?
I would say room temperature.
Room temperature water. Okay, the answer is drum roll. Room temperature water. Okay. Alright. Of course, hot already. Don't use hot water lah. Okay. But the hot you cannot use cool water also. Alright. Yeah, like what Billy said, when you take bath also you cannot use cool water. Why? Because when you use cool water, what when you notice is the child will start shivering. Alright, is shivering a good thing? Actually no. Why? Because we want to get the heat out. Alright, we want to bring the fever down.
Yeah.
But why does the body shiver? Because outside is cold.
Yeah.
When they shiver, the body actually create more heat. Number one. Number two, you touch the hand out, very cold, right? Because all the blood vessel, all the blood all become small. It close up. Then all the heat will stay in the body. It cannot get out of the body. Yes. So we use room temperature water. You wipe. Okay. Don't too cold until like they shiver. Yeah. And then you bring down the temperature. Yeah. So after a bath, wipe them clean. And then you just keep wiping them, but don't buka begitu, because they will start shivering. Then your fever very hard to come down. Something you learned today. Yeah. Alright. So this is for how we get rid of fever. Of course, the reason why we need to bring down fever is because when they have fever, like what Daddy Justin said, are they happy or not so happy? Happy or not happy?
Not happy.
Not happy lah. Yeah. Very. Imagine you have fever. What do you feel? Headache, uncomfortable, body ache. Yeah, children also feel that way. They feel uncomfortable as well. Okay, so we need to help them to bring the fever down.
I'm just very afraid of it because I have a nephew had fever until he had fits.
Fits, right?
Yeah, so for me, I don't take fever lightly at all.
Yes.
That's why I always got paracetamol in the house, everything ready.
Yes. Same as me as well. Why? Because my daughter got fever fits. I didn't expect, as a doctor myself, I didn't expect my anak perempuan, my daughter, suddenly fit in front of me. I still terkejut sikit. Alright, but good that you mentioned it because we're talking about fever fits next. Alright, so what is fever fits? As what Justin mentioned, if the fever goes very high, usually 38 degrees and above, alright, then they're feeling unwell, and their age is around 6 months to 5 years old. Alright, once they pass 5 years old, they are okay, they won't get this. Okay? When it goes too high, it can cause the brain to have a little bit of reaction, and then they will come in as a fits. You know what's a fits? Alright?
Someone.
Sawan. Alright? You see the eye go up like that. Then maybe they are drooling, they cannot control, maybe they will bite their tongue, then their hands will like that. Then you call them, they will like, they don't respond you, sometimes terkencing, terberak, some accidentally pee, accidentally poop. And then after for a while, then they will okay, then they will cry, then they wake up. That's called fits. But if it's happening in front of you,
Yeah.
scary. Because you talk to them, they cannot reply, they just fitting there.
Itu yang penyakit dipanggil epilepsi.
No, epilepsy, head switch, tapi demam pun can cause.
Oh, I see.
Yes.
Yeah.
So ini sawan demam.
Sawan.
Fever fits. Epilepsy is another thing. It's also fits, but it's not because of fever. It's because of a maybe medical condition in the brain. They can cause the fits keep coming back. Alright. But for fever fits, it's very specifically because of high fever. Then they fit. Alright. And there's a certain pattern to it. Alright. And since you're all taking care of children, I just explain to you what the pattern is. Okay. So for the fever fit, especially 38 degrees, it can happen again and again. So like now my daughter, when she gets a little bit of fever, straight away, sticker, everything there. No chance of fever. Bring hospital, antibiotic, everything out. Alright? Okay, so and for the fits, they will have their hands like that, their both hands and both legs, they will shake. Alright? For epilepsy, like just now Billy mentioned, sometimes not both hands, only maybe one hand.
Yeah.
Or maybe one leg, gitu. Or maybe the eye or the other way one. It's very different. Okay? And for fever fits, it only lasts about 2 to 3 minutes. Very short. For epilepsy, sometimes 5 minutes, 10 minutes.
Wow.
It's very dangerous, can be 15 minutes. 5-10 minutes a bit dangerous already. Can affect the breathing. But for fever fits, usually 2 to 3 minutes. Okay, and that is why part of the taking care is we need to observe the signs. Alright, so how do it happen? If let's say in front of you, your baby or a child get fever fits. Okay, first thing, don't panic. Don't like, baby the baby like, no. Don't panic. You have to take care of the safety first also. Alright, next you can put the child on the side. Okay, so what you do is you put him just sideways like this. Alright, and what will happen, because when you feed, you cannot control your swallowing. Then sometimes you will vomit. Or maybe when you're drinking milk, then all the milk, if you don't, you just leave it like that, what happens to the milk? Choke like that. Like that. So you need to push to the side. Then it will all flow out. But don't put your finger in the mouth. Last time, the olden days, they will say, need to put the finger in the mouth because you need to protect the tongue. Right? But actually, it's okay one. Because you put the when they bite the tongue, you can fix the tongue. Alright? But you just going to make sure there's no choking. And when you put at the side, the tongue also will fall out. So you won't stop the breathing as well. Kisah benar, number 1. I tell you true story. This one of my patients. Bigger dia. Alright? He had epilepsy. So his friend, one day called my clinic, say, I'm coming over now. Say, what happened? Is it the boy with epilepsy got any issue? No. Dua kawan dia, the 2 friends need to come to the clinic. What happened? So actually this boy, he had epilepsy, he was sitting in the house, they were playing game together. Then the friend ingat, last time my mom said you need to put the finger in the mouth. So the first friend is like, okay, I go first. So he take the finger and put in the mouth. Then we cannot gigit. After 1 minute, say, cannot tahan, swish. Another friend put the finger on that. So both the friend came to my clinic, same finger, I need to sew the finger. But the guy with the epilepsy, no problem. So don't put finger in the mouth, or don't put anything in the mouth, because you might think you're scared to choke as well. Alright? So number 3, hold gently, okay? To make sure don't have any falls. Let's say if on the table, why the baby on the table? Baby not on the table. Let's say on the sofa, playing on the bed, ketawa the joke. Alright? You need to make sure they're safe. Maybe on the floor, on the bed, you just hold them, make sure they're safe. There's no sharp edges and things like that. Okay? And then you observe the signs and the timing. Okay? Okay, as mentioned, how long is the fever fits? How many minutes?
2 to 3 minutes.
2 to 3 minutes. Okay, and then after that, after 2-3 minutes, they will get well. Alright, and then you need to check, make sure they're okay. How are you, baby? How are you? You know, you're okay. You need to drink some water and things like that. And then immediately bring to see doctor. Why do you need to see doctor? To make sure baby is okay. Yeah, or the child is normal. Okay, everything is checked. Or just a fever fix. Okay, because we're not doctor, right? Yeah, so we need to also check. But this fit is last how many minutes as mentioned?
2 or 3.
2-3 minutes. What happens if more than 3 minutes? What happens if more than 5 minutes?
Emergency.
Yeah, dangerous because sometimes they will shake until they cannot breathe. Or they have low blood sugar. They can shake until they got low blood sugar because their muscle keep moving like that. Yeah. So we need to quickly bring to emergency. Alright? And also maybe have to give medicine. They will give medicine to stop the fits. Because if not, it will stop the breathing as well. Yeah? But how do you? My question now is, sounds very serious, right? But today we are here, other than to do first aid, we also need to know how to prevent. Okay? I'll come back to this. How do you prevent fever fits?
Control the fever.
Yes, control the fever. Yay! Okay, give you one star. Yeah. You don't let the fever more than 38 degrees. How do you don't let the fever more than 38 degrees? What do you do? Check the temperature, sponging, kasih ubat Panadol, and then baru dia pergi mana?
Doctor.
See doctor. Okay, then you can avoid the fever fits. Of course, if they fits and let's say they are very tired or they keep vomiting, yeah, it could be infection. Yeah, so that's why after that always go to see doctor. Alright, so that's about fever. Alright, everyone learn something so far?
Yes.
Yeah, okay, high five your friend and say good.
Good.
Good. High five, high five, pick up. Alright.
Get up.
And you.
Can we have a toilet break first, doctor?
Okay, you want toilet break? Can. We have a quick break, also toilet break later, but I think we can call for a toilet break now. Okay, you do a vote up. Who want to have toilet break? Hands up. Okay, 3, 4. Really interested on the continuous. Okay, let's do a quick 5 minutes toilet break, and then we'll come back and we go back.
Okay, let's start.
Alright, welcome back after your toilet break. Okay, so before we will start into module 3, since baru pergi toilet, right? What we can do? We can do a little energizer. Okay, so like everyone stand up. Alright, we're going to take a deep breath, okay? Take a deep breath. Okay, say 1, you put your hands up like that. 1, you take a deep breath, and then come down. Okay, down. Okay, deep breath again. 2. Out. Okay, 3. Shockkan ada udara kan? Okay, now when I say 4, I take deep breath and then I want you to shout at the end of it, okay? Okay, 4. 1, 2, 3, shout! Okay, one more time 5 again shout Deep breath. 1, 2, 3, shout! Okay, and then one more time. Lastly, when I take deep breath, I want to shout yes. Okay, so deep breath. 1, 2, 3, yes! Okay, one more time, deep breath. One more time, yes! Yes! Okay, very good. Come, have a seat. Okay, feels good to breathe, right?
Yeah.
But do you know that those who are choking, they cannot even breathe? Kalau budak yang choking or those adults who are having choking problem, yeah, these are the things that they cannot do. You cannot take deep breath like what he did. So kan? Sure. Yes, very relaxing. Yeah, they cannot even say a word. Yeah, they cannot even make a sound. Yeah, and that's the issue with choking, and that can also lead to, as mentioned like just now Najwa said, can lead to death because you cannot breathe. Alright? So let's talk about choking now, module 3, especially about choking for infant. Alright? So what we see here is a baby punya face. Alright? So what can you see here lah? Yeah? Just for when you're as a non-medical team. Alright, apa kamu nampak di sini? What do you see here? What is this?
Nose.
Nose. Okay, this one?
Mouth.
Mouth. This one?
Chin.
Chin. Oh, very good. Okay, give yourself a pat. Okay, not bad. Okay. What is this?
Neck.
Neck. Okay, neck. This one?
Brain.
The head lah, head and brain. Okay. Alright. What is this pink color one here?
Which one?
Tongue.
Oh.
Right, this is the tongue. Okay.
Yes, sir.
This pink color thing is the tongue. Okay. And this is the nose. It goes all the way behind here. And the nose and the mouth is connected one. Okay. The nose is here. Oh, my nose is here. Actually, the nose goes all the way back here. Okay. So sometimes all the tai chi or all here, here and here, all the tai chi here. And especially if you got running nose, all here. Okay, but you see it comes both together and then it goes into how many highway? 1 and 2. Alright, 2 highway. Alright, this first highway is for the breathing. Okay, and this highway behind is for the eating. Alright, so let's say ada kereta, the food, your food you eat, you go through where? Go here, you go here.
The mouth.
Now nose or the mouth?
Mouth.
You eat go through the mouth lah. Okay? Unless got issue, then you pakai pose go to the mouth. And then where does the food go? Number 1 or number 2?
Number two.
Number 2. Oh, but if the food go to number 1,
Choking.
choking. So cannot go wrong road lah. The food go in the food, the air actually can go both lah, but for the lung it goes number 1. So if the food go into the number 1 here, into the lungs, you will get the choking. Automatic with this choking. Water sedap. Yeah. Does it happen to you? You drink water,
Yes.
and then what you call it? The chicken. Or maybe you eat some rice, then the rice is like want to fall the wrong track already. The rice is sitting here, right in the corner here. Yeah. Then you scared to fall, then you try to get it out. Okay. So that is when it happens before the disc. So what saves it? You see this little thing here, it's like a toll gate begitu. Like you parking toll lah. What it does is it open close begitu. So when you want to swallow, it will close this and then your food will go to number 2. So that's why they say although I don't know how, although I think it's people okay, it's a myth, but then don't talk when you eat. Okay? Alright? But this is, we call it the choking. But when we talk about choking, especially in medical, or what do you mean by airway obstruction? Means, let's say, apa ni? Tasty, right? So this pound go into where? 1 or 2?
One. Two.
Go to 2, okay? But what happens if this happens? Pound hilang sudah. Okay. But when this pound go to number 1 and then it sit right here and it block the whole thing. Choke. Yeah, that means the whole thing blocked and they cannot breathe. They're supposed to air going, but there's a whole power sitting there. A piece of the power, not about a whole piece, or like just now, that's why I say a rambutan. Yeah, and then it cannot come out. So what happened? Can breathe or cannot breathe? Cannot breathe because for the rambutan, or the power is there. Alright, so how do we save? We need to get it out lah. Okay, we need to get this other power rambutan out. Okay, there's no other way. You need to get it out. Right? So that we mean by partial or complete. Partial, that means separuh-separuh saja. So kalau separuh-separuh, like macam, like say, the nasi go inside, but you still can talk, you can cough. Alright? So what do? You try to cough lah. Okay? But if it's complete, and the whole power sitting there or the rambutan, then you need to do the first aid. Alright? So this is mean by airway obstruction. Okay, so we talk about babies. So in babies, there are 2 types of choking. We have the awake and the not awake. Alright? Awake is dalam Melayu itu apa? What's awake? Bangun. Okay? Masih sedar lagi. So baby yang masih sedar ada apa? Masih still can breathe. The eyes still open. Okay? Still got sound. The other one is not awake. Not awake is apa in Melayu?
Tidak sedar.
Dia sedar. If dia sedar, how do they look like? Gitu lah. Tidur sedar. Biru-biru sedar. Ya, tak sedar. Okay, so now for this choking, we will focus on the yang sedar, conscious first. Okay, because if this happens to you, which one is easier to settle? Sedar or tak sedar? Sedar. Because if still awake, you do something, then immediately okay. If tak sedar, then you have to do a lot of things to get it back. Alright, so but I can tell you that if he is awake and you don't do anything, you will become awake. So that's why the first aid is very important. Yeah, to make sure that you settle when they are awake. Okay? So how does a awake choking look like? Let me show you a picture and then you tell me what you see. Okay? Let's say you see this. Okay, this one in maybe in Western country lah. Very rarely got blue eyes here lah. Okay, maybe we start one by one and you can tell me what you see from this picture. Maybe start with Lily.
Mata dia besar.
Okay, very good. The eyes are wide open, correct? Najwa?
Dia punya lidah keluar.
Yeah, the tongue is coming out. Okay, very good. Tika?
Panic.
Panic? Yes, very panic look. Alright, very shocked look. Okay, is? Yes. What do you see here? Apa warna tadi? Purple or blue? Yeah, because purple blue means no oxygen, no air. Then it become purple blue. Normal color is what? Red or pink yeah, just consider okay lah. No, biru, okay? Justin?
There's baby signaling.
Yes, the signal, they're like that, they shock like that. Okay, so these are the signs of an awake baby. Alright, the awake baby won't tell you, Daddy, choke lah. 1 year old lah. Okay, so this is what you will see, and they cannot just say. You can by all you can see is like that. And maybe what sounds can you hear? Or other sounds? Can they cry?
No.
Can they shout? No. Yeah, because it's stuck. Maybe they try to cry, but then you hear very weak sound. Okay, so alright, all of you are correct. Alright, so the eyes are wide, desperate. Help me, help. Alright, blue color, yeah, is what is also mentioned. Yeah, we cough, they try to cough. Baby also can choke, but then they cannot choke. And then they feel very hard to breathe. Okay, and then they cannot make cry or any sound. This is what you hear. So what we need to do, we need to help to get rid of the choking immediately. Alright, so next I'm going to do a demonstration session. Alright, I'm going to show you what to do first. Then after that, you're going to take turns to do. And that also will be part of your assessment if you can follow the steps correctly. And if you follow the steps correctly, 80% and above, then you get a certificate. If not, then it's okay. You got extra tuition class. Alright, to practice one more time to make sure at least you get it. Because it's very important knowledge. Yeah, things that you mentioned, let's say you know rambutan at home, all of you want to know how to save. So importantly, after this training, I want you to have this knowledge and skill before you go home. Alright? So, what do we do? Okay. Welcome my baby again. Alright, so the first thing, alright, just now, they look like that. Just imagine the baby look like this. Okay? So, if you don't know anything, if let's say you don't know first aid, what will you do? Oh baby, what happened? No, baby, no. Right? Normal lah, parents. Oh, no. Then panic. Oh, go hospital. Then baby is like, gitu lah sana. Gitu sana. Sampai hospital sudah, then you know lah, from here to hospital maybe how long? How many minutes? 15 minutes. Masa tu dia pingsan di kereta, you also don't know. Okay? So what do we need to do? First thing is you need to keep the head low. Terus begitu. Okay but please hold the neck Don't begitu Alright? Awak pegang ke kepala. It happens I've seen people choking they do this before the baby then they were like Or like gitu. Don't. You need to protect the head, protect the neck. Because later you save the one, but sini patah macam mana? Then hospital also cannot also. So you need to hold the neck. But first thing you do is keep the head low. Alright? Just in case, just make sure the palm of the rambutan don't drop in further. Okay, so you put it down. So that make sure is that anything if it comes out, it will pergi mana? Sini atau sini? Okay, dia akan pergi bawah lah, and then it will come out. So first thing we keep the head low. Alright. Next we need to do back blows. Alright. Let me tarik to sini. Yeah. Let me give me a chair in front. Okay. Yeah, imagine dia dulu dia. Okay. So how do we keep the head low and give back low? Atau belakang sini. Alright. So we need to first find a chair or somewhere to sit down. Okay. So put this like that. Alright. So what I need to do next? Okay. Maybe it's still awake on. Alright. I need to flip him over so that I can pat his back. Alright. So what I do is again I need to hold the head. Make sure the head is safe. Yeah, don't break the neck in the process. Okay. Then I flip over like this. Gitu. Alright. See what I did? Hold the head. Use my arm to clip the baby like this. Hold it tight now. Okay. And then I flip over. This is below 1 years old, by the way. You don't try to flip the 5 years old kid. And probably they'll be quite heavy. Alright? Next we do 5 back blows. Alright? In between the shoulder, use the heel of your hand. The heel of your hand. Everyone point to your heel of your hand. Point. Here, okay? Between the 2 shoulders 5 times, alright? Very hard, right? Yeah. Obviously, you don't do too soft lah. Tak laku. Obviously, you don't injure also lah. So we need to be hard and firm. Okay, 1, 2, 3, 4, 5. Okay, and what this does is actually it helps to loosen the rambutan or the pau there. And then with the head down, hopefully it can come out. Alright. So, and then if let's say after this, how do you know whether it come out?
Cry.
Very good. Give this a round of applause. So let's say baby cry. Then what do you do? Kasih peluk lah. Ayo baby. Ya. Takkan dia menang. Dia cry still like that. Gitu. Ya. Oh you pak dia isi rambutan. Oh what is it? Oh peanut or Lego or everything floor. Then they cry. Then you comfort lah baby. Oh, okay, baby can cry, dia can breathe already. Then you bring hospital lah, just to check. Yeah, or gitu that. Okay. But let's say you do 1, 2, 3, 4, 5. No difference. Straight away, no cry. Again, hold the neck, flip back over. Okay, flip back over. We're still the same thing. Like that. You need to do chest thrust. Okay, chest thrust. So how do you do chest thrust? Okay, memang buka baju lah. Buka baju. Buka baju. Alright. Between the 2 nipples, 2 fingers. 2 finger right in the middle. Okay, sideways like that. You press 5 times. 1, 2, 3, 4, 5. Okay, and this will help you to press the chest to push it up. It's like just now Nazra mentioned you are handling. But for below 1 years old, you use this method. Above 1 years old, different method. But for this training, we will teach for 1 years old and below. Okay? So 5 times. 1, 2, 3, 4, 5. Okay? Anything come out? Nothing come out? Continue. Repeat. Hold the neck, clip, flip over. Okay? 5 times. 1, 2, 3, 4, 5. No difference, flip back. Okay? Continue. Head is down. 1, 2, 3, 4, 5. Sampai bila? Until when? Until come out. Or if you don't come out, then what happen?
Top comes.
If you don't come out, what happen?
Doctor Web.
Pingsan lah. Cannot awake. Alright? If not awake, then we have to do CPR. Okay? So that's why we need to do this as quick as possible. If not awake, becomes CPR. Okay? So I'll show you one more time. I give you the tips lah. Alright? So the first tip is, number one, if that happen, put it low. Okay? Find the chair, sit down. Alright? So that the baby is actually lying down my thigh actually. Yeah? Okay? Flip. 5, 1, 2, 3.
Mama nak
Oh.
Nangis dia.
keluar sudah.
Keluar sudah. Okay? 5 times. Alright? Turn back. Okay? 5 times. 1, 2, 3, 4, 5. If not, just flip back. Continue. 1, 2, 3, 4, 5. Flip back. 1, 2, 3, 4, 5. You see how fast I'm doing it?
Yeah.
Because we need to get it out as soon as possible. Alright? So that's how we do it. This for yang apa? Sedar atau tak sedar? Sedar. Okay? Alright. Who want to go first?
Please you go lah.
Siapa yang paling banyak anak punya?
Saya banyak cucu.
Banyak cucu. Alright, come. You can get a chair. See it. Sini. Alright. Okay. Alright. You can start.
Pegang leher, okay? Ini.
Keep the head low.
Low like
Keep the head
this.
low. Yes.
Then turn like this. One, two, three, four, five.
Alright. Okay.
Alright. One, two, three, four, five.
Okay. Alright. Okay. Let's open for some evaluation. Your bagi comment. Alright. Okay. Justin, one thing that she did right.
Did right?
Did right.
The chest thrust.
The position is correct. The position is good. Deep enough also. Okay. Is satu yang one thing that can be better. Yang boleh bagus lagi.
Back low.
Back low. Macam mana?
Kuat sikit.
Kuat sikit. Okay, very good. Anything else? Any comment? Fika?
More fast.
Faster a bit. Okay lah, tak apa lah. First round lah. Okay. Yes, a bit faster. Azra? Mau support sikit. This baby, is it light or very heavy?
Enggak, tak apa.
Not very heavy, right? But I can tell you, normal baby heavier. Baby biasa lebih berat. Normal baby is heavier. So this one, you have to hold bagus-bagus, then only you flip. If not, you terjatuh. Gitu. Alright? Okay, let's try one more time.
Balik lagi.
Yes, come.
Asli. Macam ni.
Okay.
Pusing ya. Saya buat
Yeah.
slow supaya.
Yeah. So okay, when you turn, you hold first. When you put down, then only you let go one hand. Okay. Yes. Keep the head lower, so your leg can come out a bit further. Gitu. Yes. Alright. Okay. Keep your leg out a bit, so that it can be low. Yes. Okay. Again. Belum keluar lagi kan?
Belum.
Belum nangis lagi kan?
One,
Okay. Semua.
kaki. Okay.
Alright, good job. Okay, alright, who's next? Yes. Go.
Yeah.
Come. You want to see in front here? Yeah.
Yeah.
Go. Kursi bos.
Yung kucing.
Are you left-handed or right-handed? Right-handed. Start with your left hand. Okay, 1, 2, 3, go.
Kaki kasi.
Sudah lah. Tadi fokus.
Yeah. Okay, so one thing she did well. Apa yang dia buat yang bagus?
Dia buat choking di chest dia tadi.
Okay.
Choking. Dia apa? Chest apa?
Trust.
Chest thrust. Alright. Deep enough. Alright.
Yeah.
Okay. One thing. Any comment? What do you think, Ika? Good.
Sebab dia pegang
Correct way is. What do you think? How was the choking dia buat tadi? Technique.
Kasih tolong itu.
Kasih turun lagi. Okay, good comment. Maybe the kick can go a bit lower a bit, huh? Yeah. Because if a bit too high, you pat, then you don't really move. You get to be a bit lower. Okay, that's it. Any comment?
She should know when to stop.
That's true also. That's true.
Sudah nangis.
Sudah nangis lah. Yeah, sudah long. Okay, very good. Alright, give another round of applause. Alright, very good. Okay, who's next? Alright, that's it. Okay, go.
Left-hander also different doctor kan?
Your left-hander, is it?
Yeah, I am.
The back blow you use your yeah. So your back blows use your other hand. Your chest thrust use your dominant hand. Yeah. So you start on the right side. Start on the right side. Yes.
So they move.
Yeah.
Oh, okay,
Yeah.
alright, okay, good. Okay.
Okay, everyone. Được á? Later you give comment á. Okay, very good. Yeah, must be very big rambutan. Alright, okay, round of applause for that team. Okay, come, evaluate. Who will start first? Ada apa-apa komen?
Ini lah gaji baru.
No comment.
Hah?
No comment.
No, what good thing that you do? Apa yang bagus? Pas, cukup kuat, okay, the back blows are strong enough.
very
Very
focus.
focused. Okay, really?
Sambil ulang.
Cara dia handle dari baby itu pun kasih apa pun.
Alright, very secure lah, very good support. Okay, I'll give you extra 5 marks if you can tell me one thing that can be improved.
Salary. No lah, we are discussing. What?
No, we'll be learning together. We learn together.
Tadi masa sir kasih
Tentu saja maksudnya. Everything, you know.
kembali baby dari
Yes.
sini ya.
What is it, please?
Dia punya kaki begini, itu kepala baby itu selaras dan tidak turun sedikit.
Oh, ya.
Okay,
Yeah.
alright, boleh turun sikit lagi. Alright, okay. Ada lagi? Good, extra 5 marks ini. Okay. Any more? Alright. So one thing, if I may, just now the second round of chest thrust, you were a bit low.
Oh.
That's why you get a cut sound. Because you were down a bit at the tummy, you were here already.
Yes,
So you should go a bit. It's actually like a normal CPR here, man. It's in the middle here. It's not your middle, that's why you hear the sound.
Yeah, maybe not crying.
That's why we need good training at this. Because when we panic, then we cannot do the proper. Because it's not about doing the first aid. You need to do the right way also.
Yeah.
If not, tak laku or not effective enough. Alright? Okay, very good. Round of applause for Justin. Not angry lah. Bukan lah. Alright. Please, Pika. Pika, alright, good. Come.
20, you know, it will be very helpful for you.
Come, have a seat. What, talking to the what?
And the baby did.
Okay, which hand are you dominant? Which hand is your right hand? Okay, so start my left first. Side here. Okay, hand that. Okay. So you see that you hold that head here, the leg is between your hand and that.
Yes.
Okay. Then you leg to leg. When gitu. Yeah.
This?
No. This like this. Yeah, this is my sugar. Yeah. Okay. Click. Okay. Yeah. Put your tank up. Good. Letak diri di atas. Letak sini.
Okay.
Okay. Kasih cross. Okay. Next.
Then, patah leher.
This?
Okay. Three, four, five. Okay. Okay. Flip one more time. Okay. When you flip, okay. You kan you hover a bit Alright. So when you flip your hand have to flip like that. Kepala. Okay. Yes. Always like this. Okay, you flip from one quarter to the other quarter, left to right. Yes. Okay.
Yes.
Yes. Okay. Very good. Okay. Practice one more time
Yeah.
Because tadi smooth Okay. Do one more time. Satu kali. Okay, bawa macam Okay. Makasih pas. Alright.
Oh, dengan baby dah bisa. More yang baby.
Baby terus jatuh di bawah tu. Okay, you have to hold, you have to hold pas sikit. Okay. So this hand to the hip. Ini tangan dia. Okay. Alright. Then hand, tip the baby, tip this. Sorry. Kita letak atas kepala. Jadi tip gitu. Okay. Then you turn. Okay. Secure, baru kau lepas tangan. Okay, 5 times. Like goes. 5. Okay, before you turn, same thing. Hold, make sure baby tight, secure. Then you flip to this side. Gitu. Press atas baru kau lepas tangan ni. So baby pun for now. Sideways. Yeah. Okay. Very good. Then you go. Okay. Then you flip the other side. Very good. Then you go. The other side. 5. Alright. Very good. Give Vika a round of applause.
Okay, quick question. Why the finger must be sideways when you do the thrust?
Actually, this one is just actually this is because this one is a bit more than angle lah. But actually, you can do like this actually. But prefer like this because this one you step into the
Well,
baby.
you pushing.
Yeah, you're pushing into the baby. So they always suggest that. Even CPR also we do.
Right, yeah. Oh, okay.
Okay, alright. I think because terus kasih correction untuk dia. Yeah, I think she did much better. I think give a round of applause. I think best improve. Yeah, best improve from the first one to the second. The second one almost good. 99%. Alright. Okay, last but not least is
Awas.
Macam buang.
jangan ni mahal ni.
Bila baby ni dia makan.
Okay. Down. Alright. Dua kali sudah masih kecil kan? Ya, besar atau kau tu?
Walau ni. Dia mau pusing dulu orang okey.
Peluk lah. Ni, belum ada chance dengan anak lagi. Alright. Okay, alright. Yes, come evaluation for is.
Tadi only one I think that he can go lower than that.
Okay, lower. Alright, good things. Apa yang dia buat bagus?
Cara dia bagi bantuan kecemasan dia pun cepat juga.
Alright,
Dia kecemasan.
good.
Tak, saya rasa dia buat apa?
Okay, right, Vika.
Okay, very calm.
Very calm. Actually, that's what I like about this. Yeah, very calm, very steady. Which actually, when we do first aid, is most important. Because first aid, yang penting you cannot be panic. Once you panic, right, you forget everything. You have to be very calm, very steady. Follow the step. 1, 2, 3, 4, 5. Flip. 1, 2, 3, 4, 5. Flip. Very routine. So I think this one is the best for this one. Give a round of applause. I see you. Steady betul. Very steady. Alright. So, okay. So next time, if let's say kalau ada baby yang choking, do you think you can handle?
Boleh.
Yeah, more practice lah, more practice, and then we can even practice more also. Okay, so since we are on this topic, alright, and then we're talking about choking, I also would like to touch a bit about what if baby become unconscious. Yeah, because let's say if you do all these things, back blows, the chest thrust, but then at the end, baby still never wake up. You do after a few rounds, then you see baby still blue, not breathing anymore. Alright, no more sound. That means, kalau no more sound, what it means for the baby? Sudah? Tak sedar lah. Tekan mati lah, tak sedar. Alright, so since I think you can also briefly touch a bit on the CPR, alright, but you also touch a bit on module 4 as well, okay? Okay, so let's go next lah. Yeah. Okay, yeah, one more thing. Last time, dulu they will teach you to do finger sweep. That means let's say if you don't see anything, you try to pour it out. But if baby is awake, don't put anything in the mouth. Because baby is like the gram sudah. You put your finger in, he will bite your finger. Nanti putuskan punya jari dalam. Yeah, so you don't blind finger sweep unless you see something come out. You see like the rambutan in the mouth, then you can open, you dig it out. Alright? And then after everything, of course, bring to the ambulance. Okay? So we did a practice. How do you prevent choking? How do you prevent choking? So daddy they can really, how do you prevent choking?
Don't put small objects around the house.
Don't put small objects around the house. Very good. Okay, other than that,
Feet very small quantity, not big quantity.
alright, feet small, huh? Yeah, don't big one time go short, okay? Yeah. How about Nashwa and Billy? Yes, very good. It's always, let's say the baby is eating, alright, make sure you're always there to keep an eye. You need to always watch the baby when they feed. Okay, don't let the baby feed itself. Okay, then I go and play my game. As parents, yeah. So when baby is feeding, we need to be there and then we need to see the best is they eat together. Yeah, makan together at the table. Very good. What else can we do? Yes, Tika.
Teaching how to chew properly, because some people still don't like chew properly. Yeah.
Alright.
It's very important.
Okay, so don't swallow so fast and
Yeah.
things like that. Of course, this is also easier taught to baby who are a bit bigger. Yeah, those toddlers like 3 years old, 5 years old. But for below 1 years old, very hard to ask them to chew. But like what Fika mentioned, one good point also is you need to give the food that is enough for the age. Yeah, so let's say the baby is 6 months, then what do you feed the baby? 6 months yang makan tadi kan? What do you give?
Porridge.
Porridge, yang blend lah. Need to blend everything.
Food.
Soft food. What do you mean by soft food?
Easy to swallow.
Easy to swallow Don't give pau lah Don't give pau, don't give rambutan lah Okay, don't give burger 6 months old only. Alright. And if let's say you want to get baby snack, you need to check the age. Yeah, they're 6 years old, 6 months old. Right? There are some baby snack that say 8 months, 10 months. You don't give that one to baby because that one he cannot swallow. Okay, so mesti bagi that one. Alright? Okay, so yeah, generally that's it. Then of course, if anything, you just need to be on hand to watch out. If they got like adik-beradik, other siblings, need to make sure that all the toys are not scattered around. Because now baby, everything is like, oh, I see, wow, what is this? Color. Masuk mulut. Even small things also masuk mulut. Then whether it come out or masuk, we don't know how to say. Yeah, so they have to be careful as well. Alright, so that's how we prevent choking. And then by that, we can make sure that this doesn't happen. Okay, of course we acknowledge that you've learned today. In case you are there, also you can also give the first aid if needed. Alright, so now we also briefly touch about CPR since we're also talking about choking. Alright, and since you're all very eager to learn more about choking, yeah, so I'll also touch about CPR, especially if the baby is sudah pingsan, tak sedar. Alright, what do we do? Okay, so why do we do CPR? Okay, so one reason with choking just now, if let's say the rambutan or the pau, as mentioned, you block into the air. Alright, so baby cannot breathe. If there's no air going in, then what will happen? Yes, will pingsan. But most importantly, antara organ semua, which organ is the most important organ? Okay, got three ini, the heart, lung or brain. Which one is the most important? Okay, try one more time. Okay, alright. Who say lung? Hands up. Okay, who say heart? Hands up. Who say brain? Hands up. What's this? I don't know. Not sure. Okay. The most important organ in the body is the brain. Okay? Because the lung can stop, the heart can stop, but if you do CPR, you can restart the heart and the lung. But if the brain die, brain death, can you bring back the brain? You cannot bring back the brain. So the most important organ is brain. Okay? So very good. Okay, give yourself a pat. Good. Pandai. Okay. So in this case, the infant. Alright. So now the issue is that when we use CPR, we need to make sure got the blood to the brain. Even though the heart and lung can stop because either drowning or either choking, alright, it can stop. But we cannot let the brain stop. Because if the brain die, the infant or the baby or the adult, you can, even if you kasih balik dia, dia pun on the bed sajalah. Yeah, cannot function. Yeah, brain very important. So the CPR, you see the movie lah. You do CPR, then you like drama. I can tell you, it doesn't happen. Very rarely it happens. Like 5% they will wake up back on the spot. Most of the time, they will still coma one. Then after a few days in hospital, then only they will balik sedar. Alright? But most importantly, although they pengsan sana, you need to make sure got apa ni? Oxygen to the brain. Okay? So let's say this is the infant or the baby. Now, because the brain need oxygen to live. Alright? No oxygen, dia akan die. So if there's no oxygen, it will die. So we need to, from the heart, because in the blood, although they stop breathing, in the blood still got oxygen. Yeah, still got tabung dia. Alright? So we need to make sure this blood from the heart goes to the brain. And you can still survive. Alright? Apa ni 4 minutes. That means if the brain got no oxygen for 4 minutes, the brain will start to die. Part dia akan die. After 4-5 minutes, time, then the whole brain will die. Then memang no chance to revive. So that's why when you see like real case scenario, kisah benar, like badminton court or di mana-mana, kan? Sometimes kami nampak got people pingsan, right? They fall down, they faint. Then usually what they do? Okay, slap. Then what they do? Ambil gambar, social media lah, call ambulance lah, tengok-tengok lah, kasih fan-fan dia, gitu.
Buang air.
Buang air. Bangun. Pasti tepuk tangan, tapi tepuk badan dia. Tapi actually the heart stop already. The time ticking, tick-tock. The fella no one helping. Some is nampak baru got their case recently the badminton. Put the leg on the what, kasih tinggi dia punya kaki. Yeah? You put your leg up, but the heart not pumping. How the blood go to the brain? Right? So what you need to do actually? CPR. As easy as CPR. You do all those kasih fan, everything doesn't work man. You need to do CPR. Okay? So this is what we will teach you today. Alright? So this is a very quick video. Alright? But for purpose of this choking, we will skip this video. Alright? We will come back to that when we touch a bit on the module more. Okay? Alright? But for CPR, generally it's these steps. Everyone read together with me. 1, 2, 3. D-R-C-A-B. One more time. D-R-C-A-B. Okay, what does D stands for? D stands for danger. Alright, R stands for response. C stands for compression. A stands for B stands for breathing. So in this case, now the baby is choking. Alright, so now they cannot breathe. So the oxygen is, they cannot breathe, the lung is stopped, the heart is stopped. But we need to make sure the oxygen goes to the brain. Alright, even though the baby tak sedar. Alright, that's why we need to do the CPR. Okay, so very quickly, alright, before we go for our, I think there's a toilet break due also. Alright, but before we go there, I will demonstrate to you. Then after the toilet break, come back, then you'll see the video, and then we'll do the demonstration. We'll do the demonstration together, which also is the second part of your assessment. Okay, but first let me do the demonstration for this part first. Okay? Alright. So for this purpose lah, let me bring the baby dekat sini. Jangan jatuh. Alright. So first apa tu? The first letter is
D.
D stands for danger. Alright, so make sure it's safe lah. Yeah. Kalau let's say baby is in the swimming pool or tengah-tengah jalan, in the middle of the road, we have to move to somewhere that is safe. Alright, and we need to put on a hard surface. Okay, because if it's let's say on a soft surface, like on the bed, on the sofa, then we do CPR, then maybe we together. Alright, so check for danger. Next, we need to check for response. Okay, so how do you check for response? Kalau dewasa, in the adults, we pat here. But for kids, we pat here. Okay. This is the most sensitive place for the infant and for baby. So it's baby, wake up, baby, wake up. Right? Baby, wake up. And you need to pat and you need to shout at the same time. Yeah, Uno's sleeping. Baby, wake up. Bangun. Oh, nasib. Alright? So you pat for response. Okay, if no response, you need to call 999. Okay, my question here is, who here called 999 before? Call 999 before? No? Alright. So, I come back to you. When you call, let's say lah, you pick up the phone now and you press 999. Who will pick up the phone? Who do you think will pick up the phone? Najwa?
You know, apa ni?
Ini?
Komputer yang punya suara robot.
Komputer suara AI?
You never call 999 before.
No, never.
Emergency line? Okay. Right. Last time you call 999, what do you call for?
Get an operator.
No, you call for what?
Accident.
Accident. Okay. So when you call, the police pick up or who pick up?
No, operator.
Operator. It's like Pizza Hut. You pick up, it's like, hi, yes, how can I help you? There's a what you call a crisis center. There's an operator that pick up and they will tanya you banyak. They ask you a lot of questions. Alright? So when you call 999, especially let's say the baby in front of you, don't call 999. Then you start here. Hello? Yes. Yeah, I got baby here. Let's sick, I think. Alright? Please don't do that. Why?
Time.
How many minutes? 4 minutes. The time is ticking. Tick tock. So if I'm one person, what do I need to do? I call tick and then apa saya buat? What do I need to do? Aku speakerphone. I can tell you they ask you a lot of questions. They want, because you call 999 for police, you call 999 for ambulance, you call 999 for fire engine. You need to know what I need to send. So if you say, oh, a baby cannot breathe and things, then they will say what? Say ambulance accident, they call 999, then they will say what? Maybe they send ambulance, they need to send police, they need to send fire engine. So they need to arrange all this. So if you're one person, you call 999, put speakerphone, loudspeaker. Okay? If let's say I'm here and ada banyak orang sini, everyone here. So what do? Do I call? No. I say, Billy. Baby no responsive. Call 999, get an ambulance, and get back to me. That means you call, okay, then you need to report. Ambulance on the way. And get an AED. Alright, so what is an AED? AED is something, alright, it's called a automated external defibrillator. What it is just satu machine, alright, that if the heart stop, it can bagi electric sikit untuk kasih jump start itu heart. Alright, but not many place ada. Some place ada, some place tak ada. Okay, Sabah, not many lah. Okay, so what we do is we just call ambulance. If you can find AED, get AED. If not, just call ambulance. Make sure ambulance datang. Alright, okay, so that is called 999. Alright, and then next we need to check whether ada breathing. Okay, so for adults, we actually check the pulse. Untuk nadi dia. But for babies, we don't check the pulse because susah mau cari. Okay, alright. So we just check for breathing for your level lah. Yeah, non-medical, we just check for breathing. So how do you check for breathing? Okay, so one hand you letak di forehead sini. One hand on the forehead. Okay, and then you kasih push up sikit begitu. Yeah, so that the tongue won't block. Okay, if like that, the tongue might come and block. Yeah, just now I show you the tongue very big, right? It might block the breathing. Okay, block the highway number 1. So we push up a little bit to make sure that it open a little bit space so that air can go inside. Of course, don't push all the way up, sakit kepala. Okay, this also cannot breathe because the leg cannot, and maybe the neck very short. Okay, so we only push a little bit. Okay, and we look at the breathing. How you know whether baby is breathing? You see the chest need to up and down lah. If not move, is it breathing? Not breathing. If move a bit, right? Kalau getar-getar begitu, is it breathing? Not breathing. Okay, breathing must be. Sometimes you feel like you see like you move a bit, but it's not a full breath. Sometimes you will also get gagging. Gagging that means it's not breathing vessel. It's like flat. That's like they're very long kan. Gitu. Like nafas tak akhir begitu. That is not breathing So breathing for baby, especially at 1 year and below, is about 50 to 60 breaths a minute. So very fast one. You can see the breathing. Dia boleh naik turun gitu. Okay. So if you don't see anything, not breathing. So how long you need to check the breathing for? 10 seconds. So okay, look, so okay, check 2, 3, 4, 5, 6, 7, 8, 9, 10. Not breathing. What do I need to do next? Compression. Okay. So compression at the same time. Tadi let's say kalau ada choking lah, right? I do compression here. What does it look like? It's not choking. We did something like that, so kan? Which was apa tu? Chest thrust. So when we do this, we actually help to push the choking thing out also. Alright. So let me teach you how to do compression. Okay. This one is for now into the way, right? So easily within the nipple. Okay, 2 fingers. Right? So some people do like that. I like to do this. I used to like to use this 2 finger. Gitu. Yeah, macam gitu. Okay. So between 2 nipples, right? Draw a line. Put these 2 fingers like that. Like gitu. Okay, which is right between the nipples here. Okay, and what? How many times?
39.
30 times. 30 times. Okay. Alright, then this is how we do it. Here you go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Gitu. Alright. Dia ada beat dia. Okay. So cannot be too fast. No baby, no. Tak boleh Siapa? Naswa. Takut stress. No baby, no jangan. Also cannot too slow. Yeah, because itu jantung you have the certain rhythm to push the blood. If not the blood tak sampai, the blood don't go to the brain. But go very slow. Alright, so there must be a rhythm. Okay, and so usually in America they like to use the song the Staying Alive. You know, so 1, 2, 3, 4, staying alive, staying alive. Staying alive, staying alive. But now modern got new song. We're going up, it's a moment. You know Golden? Same beat. Same beat. The K-pop Demon Hunter song.
Yeah.
Same beat. Okay. So if you're modern nowadays, Gen Z, you can sing Golden. Okay, alright. But that beat, 100 to 120 beats a minute. Okay. And kalau nampak, it's quite deep also. I press. Okay. And how deep? It must be 1/3 of the chest. Yeah, so deep. Yes, that's how you can press the heart. If you do that, this is massage, not compress. Okay. Also, you don't purposely press all the way down, sampai you use that. Use maybe easier. Boleh patah sikit lah. But even though ada patah sikit, it's okay. You can get well, and okay, as long as you save the life, you can press the heart. Okay. So again, one more time, I do 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Alright, next I need to give apa? Sudah. Check ni. Alright. So let's say I sudah head change lift, but I see there's now choking, right? Dan nampak, rambutan. So what do I need to do? Clear dulu, jangan blow dulu lah. If you blow, suddenly you go back inside. So I need to clear. So I open the mouth, I pull this one down, I use my finger, I scoop up the rambutan. Okay, or pao lah, whatever lah, fish ball, leg ball lah, whatever thing. Okay? Alright, then nothing, then I give blow. Okay, for below 1 years old, alright, don't have to pinch the nose straight away, the nose and the mouth sekaligus begitu, because it's quite small. So when inside, I'm not going to actually do it. Okay, so the mouth and the skin must touch. Sini, you blow. Alright, and you blow. When you blow, you need to keep your eyes on the chest. See the chest and make sure the chest go up and down. That's how you know got oxygen masuk. Okay, so blow, naik turun, blow, naik turun. Okay, so how hard do you blow? It's not berdunan. Jangan tu berdunan. I know some people lah, oh, tak naik, oh. Nah, gonna damage, will injure the lung. Okay, so just enough to see go up. But you also do. Jangan kedekut lah. Up, down, up, down. If you blow and you don't see it go up, right? What does it mean? No oxygen.
Tidak sampai ke angin.
Ya, tapi saya tube lagi dia masih tak naik. What about you don't buat? Maybe ada block. So there's two things. Either I can adjust again. So I just adjust, cuba adjust balik. Okay, then I try to blow again. Still cannot go up. Tak apa, skip saja. Terus buat compression. Okay, because for this one, the most important, alright, is it the compression or the breathing? Compression. Compression hands up. Compression, compression. Alright, breathing. Breathing hands up. Oh, that's what space people like it.
No, that.
Okay? Yes, the answer is compression. But for budak also breathing also important. Right? But the compression need to be also first. Right? Because if you compress, then only the blood go to the brain. Okay, you can breathe, but if you don't compress, the blood don't go up. So the compression, you must eat. Don't wait too long. Alright? So let me do the whole cycle again, okay? So 30 times 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Low, up, down, low, up, down, continue. 1, 2, 3, 4, 5, 6, 7, 8. So cepat. Because you cannot waste too much time on this. You need to measure the compression. Okay? So what's going to happen? So this I just finished the demonstration for this. Alright, so my question now is, do sampai bila? Do until when?
Sampai
Okay, so compress tadi, cry ni.
Then you stop.
Then stop. Okay, don't continue compress. Okay, but it's not wrong juga if you're not sure you compress. It's still okay one. Yeah, for infant. or apa?
kalau tidak sekali
Yeah, nanti ambulance come. Or maybe ada kawan ganti lah. Maybe like Justin come ni. Bro come, I take over. Penat kok tangan. Sudah penat tu jari. Want to break ini. So Justin come take over then switch. Okay, or ambulance come. Okay, please don't. But okay lah, sudah start half an hour, I stop sudah gitu. Don't stop yourself ah. Alright, because as long as you keep doing CPR, there is blood going to the brain. We have had cases they do for 1 hour. Ambulance come, you arrive, they survive. Alright?
One person or many person took over?
Of course, many times lah.
1 hour is crazy.
Yeah. Okay. So this is for baby. Alright. So now I think it's time for toilet break.
Yeah.
Okay. So now it's go for toilet break. So after toilet break, we'll come back. We'll see the video. Yeah, from the American Heart Association on how they do. Alright. Thank you, everyone. Welcome back from your toilet break. Alright. So we'll come to the last part, which is the wrap up. I think it's been a full 3+ hours, coming to 4 hours that you've been here. I'm really hope you've learned something today. If you've learned something, put your hands up. Alright, very good, thank you. Alright, so now we're going to do a very quick question and answer session. I know some of you have some burning questions that you have throughout the whole 3 hours plus. Some of you already gave me the questions, but then some of you may have some other questions that you have. Okay, but please do answer, please do ask me, because if you don't ask me, later I will ask you. Okay, alright, so any questions on the floor? Yes, please.
I want to start about the variable fits. Does it can happen to adults that the same things like fits?
Alright, febrile fits, the fever fits can it happen
To
to
adults.
adults? Alright, good question. The answer is no. Alright, fever fits only happen to children between 5 years old and below. 5 years old and below. And it's because, as mentioned, the fever, berapa tinggi? How high is it? 38 and above. Can cause the brain to have a little bit go into these states where it goes to the fits. Alright? But fever fits, after the fit, there is no damage to the brain, there is no long-lasting effect. It won't become like epilepsy or what we mentioned just now. After 5 years old, it won't happen again.
Even though your temperature is above 38.
Even though above 38, no. But I think one of the things that you are probably asking or thinking about is that some cases in adults or in children, you can have high fever and also have fits, right? But this is more the dangerous type. That is something we call the infection of the brain. Yeah, brain also infection, jangkitan. Okay, that one you can also have fever and you have fits. That one you can happen in any age group. Children all the way to adult to elderly, old people as well. Right? But that one is got bacteria or virus that goes into the brain and the brain lining, the lapisalia, and they can cause infection. So that is more serious, that's a different thing. But for fever fits, it's just for 5 years old and below and because of fever. But as non-medical, my suggestion is at the end of the day, after the fits, once baby is okay, always bring the doctor. Then doctor will have you to check. Can they okay or fever fits? Yeah, check. Oh, infection. Have to be admitted hospital, then check insurance. Alright, good question. Thank you for the question. Alright. Okay, any other question?
I have one.
Yes, Justin.
The AED that we have in public areas, the patches I see are meant for adults. Can it be used for children?
Alright, good question. So just now I did talk about the AED,
Right.
the automated external defibrillator, which is the machine to give electric to shock the heart, especially if it stops. Okay, so in public, actually the AEDs, there are two settings. There is adult setting and there is children setting. Okay, some AEDs, depends on the brand, okay, can only be used for adults. Some can also got children setting where you need to click the button, children setting, then the electric jolt is lower a bit, okay, and then you attach differently, one in the front and one in the back. For adults, you attach like this, one on the ear, one on the ear. Yeah. For children, it's one at the front and one at the back. Okay, but there's also an age limit. If I'm not wrong, it's 2 years old and above. Then only you can use the AED. So for in this case, infant, that's why I didn't talk about AED, because you cannot use. Yes. Good question. Yes. So in this case, let's say for infant, or so happen you bring the AED, there is no children setting. Okay, we still have to wait for the ambulance to come.
So don't use like no children setting, don't use.
Don't use. Yeah, if you're not sure, don't use. But if you're very sure it's an adult, you know, you use the AED. Because if you use the AED, it will increase the success chance of like 2 times. From 25% you increase to 50%. So important the AED. Okay, good question. Alright. Any other questions? Burning questions? Yes, Najwa.
Tadi kita ada case itu kan burn dengan apa yang mana mau bilang, what should we avoid during kita treat, kita rawat, apa yang patut kita avoid semasa kita rawat burn and cut and bleeding.
Burns, cuts, and bleedings. Okay, what to avoid?
Yeah.
Alright. So I think there's two questions in one.
Oh.
Okay, what to avoid when you have burns? Okay, let's start with burns first. Alright. So burns, the treatment method, as just now we talked about first aid, is to put under running water. Okay, for 20 minutes. Alright. What we learn probably from our parents, those one you don't do. For example, put Colgate. Don't put butter, oil. Okay? Yeah, kicap. Yeah, sauce. Okay, see sauce tiram. Okay? Don't put ice. Okay? Although it's burn, say hot, I put cold, I put ice, cannot. Because it will cause ice burn. Cold burn. Alright? So the way to do is you put under running water for 20 minutes. Yeah. Then of course, if it's a big burn, alright, if it's like more than like one hand like this, or rather on the face, the body, the one you must bring to the hospital for doctor to check because it's quite dangerous to have burn, hot water burn on the face and the body. Yeah. And you say what not to do? Yeah, let's say if the hot water is over the whole body, yeah, on the clothes and everything, you must take out all the clothes. Don't buka. Right? Kisah benar number 3. Real story. I have one patient grew up at Adela when she was young, 5 years old. She kena hot oil because the mom was cooking this about hot oil. So the mom like, oh, no, the clothes got all the oil. So she took out all the oil, but malu lah, tak buka spender. So every time the skin very nice, except in here. It's like, oh, koyak. Yeah. So don't malu lah, buka everything. Alright, and then go under running water. Even though here first, unless you see that they have difficulty breathing or they have like almost want to faint already, like going to pingsan or they already pingsan there, faint already, straight away bring to hospital first. Alright, so that is for burns. I think your second question is for cuts and bleeds. Okay, for cuts and bleeds, okay, make sure, I noticed in Sabah, when they got cuts or bleed, they will put a lot of daun.
Ya, untuk Malaysia gitu.
Yeah, in my clinic, I see some of the like laborers, foreigners, they will take some grass, I don't know, some daun, something, then they will like, or maybe the smoked tobacco, they will put there to stop the bleed.
Kopi.
Coffee beans, yes, coffee beans, or the tea leaves, yeah, don't do that. Alright? All you need to do is take a clean cloth and put on the bleed and just hold it there. Okay? For 5 minutes, 5 to 10 minutes. Alright? Then after 5 to 10 minutes, you can open, and if you stop, then you can clean the wound. Small wound. Clean, water, soap. Then you apply your antiseptic like Dettol or your yellow lotion, things like that. Okay, so what happens if you put the cloth and you hold for 10 minutes, ta-da! It's still bleeding. What do? Tutup balik lah. Alright, check lah. Gitu. Close back and you go to the hospital. Yeah, and then the doctor will have their own way to fix it. Either we sew it on the spot or we put some medicine there and things like that. Don't use coffee bean, tea leaf and all those things. Because I've had a case of that. We have to clean it for 1 hour to make sure we get all the leaf out. Itu susah to clean. Then all the leaf masuk itu kulit lagi, go under the skin and everything. Then we scared of infections or more. So we need to give antibiotics and everything. It's like so very easy. Just go to hospital. Okay. Good question. Did I answer your question? Alright, very good. Yes.
Regarding the 10 minutes we said this now, is there a time limit that we should know? Like, okay, 10 minutes, if it doesn't stop, I need to go.
Yes.
Oh, 10 minutes is the maximum.
10 minutes, yes.
The mouth works the same way as well. The teeth, when you x-ray the teeth, you keep bleeding.
Yes.
10 minutes, huh?
Yeah. Some places might bleed easier. For example, like in the mouth, because it's always wet. Look at the saliva there.
Yeah.
So it's very hard to stop the bleeding. It can inform the clot. So that's why it always bleed. Another place always bleeding, like let's say falling, especially in children, they fall down. They usually fall where?
Yeah.
Like that. Yeah, forehead sini or the eyebrow here. You bleed a lot because the skin here is very thin and it stretches, so it's very hard to stop the blood. So sometimes after 10 minutes or so you cannot stop bleeding. Then you have to go hospital also on the spot. You will still drip blood. Yeah. So these are some of the areas. Of course, big cuts are very big one. The one you don't take one lah. Just stop and then just put your bandage, wrap. Send the hospital. Okay. Good question. All right. Any more burning questions that you have? Yes, Vika.
I want to ask, is it a must to have a certificate to do first aid?
Interesting question. I think we did discuss this over toilet break a little bit. Alright. Actually, not necessary. Anyone can do first aid. Yeah, as long as you have the knowledge to do it. But most importantly is you must be confident. And also try your best to learn the right technique. Yeah. So of course, if you want to make sure to do the right technique, because anyone can do CPR, but if you want it to be effective and to save a life, you need to make sure you have the right technique. Then you need to go for a course and you get a certificate. It's even better. But depends. But let's say if your work, you need a certificate for your work. For example, if you're working with oil and gas, or maybe for a diving center, or certain like factories now, they need someone to be certified, then you need a certificate for them. Yeah. But nowadays, we're also doing a lot of awareness course together with other organizations as well, NGOs, St. John's, Red Crescent, where we teach the public on how to do CPR. Yeah. Get there for 10 minutes, we teach them how to do, at least they know how to feel the method, okay. Alright, better than zero knowledge, better than watching and watch your friend just lying down there, don't know what to do. Yeah. Yes. But of course, if you take the cert, it gives you confidence, then go and take the cert. Okay, contact me after this. Alright, good. Alright, any other questions?
Saya mau tanya.
Yes, Lee.
Kalau yang budak dia umur dia 1 tahun 2 tahun, bolehkah kalau dia choking kita bagi bantuan apa macam tu yang bunyi tu?
Hemlick.
Hemlick.
Yes. So 1 years old and above. So this is for what we are talking just now is for 1 years old and below. For 1 years old and above, usually they can stand up already. And when they can stand, we use the Hemlick to do. Yeah. So how we do? Maybe just briefly. Okay. Is same thing. We go to the back of them, but because they are very short, so we have to kneel down. Kneel down. And then body close can do that. Yeah. But that one again is another session. But yes, you're right. We use the Hemlick maneuver for 1 years old and for kindergarten going school, for school children. Yes. That's if they are awake. Okay. Kalau dia sedar, then they can stand. If tak sedar,
Kalau dia tidak sedar, dia budak besar tu kita buat sama juga.
sama CPR. CPR tu. Okay. Good. Alright. Any more questions? Okay. If no questions, alright. We will go to the what have you learned? My turn to ask question now. Alright, come. Everyone stand up. I love to do this. Sitting. Okay. Alright. So each one tell me one thing they learn, then they can sit down. Okay, who go first? Justin. Alright.
I learned today why you need to give breath, mouth to mouth breath.
Okay, why?
Because there's the oxygen flow to the blood algorithm.
Alright, very good. Okay, this is it. Tak boleh copy ya. Yes. Siapa dulu? Nazwa dulu.
Jadi saya belajar yang brain dead tu yang boleh menyebabkan
the 4 minutes, very important, correct? So within the 4 minutes of collapse, we need to make sure CPR so that you can supply the oxygen to the brain so the brain won't dead. And we got at least you got chance to revive. Very good. Alright. Yes. Billy.
Ini saya belajar bila budak kena demam, kita tidak boleh kasih dia area bronchoscope sebab boleh menyebabkan saluran darah dia mengecut.
Dia akan menggigil kan?
Akan menggigil.
Yeah. So right, what is the right way?
Kasih mandi dia, lap, sebab itu biasa lah.
Yes. But you don't have to also wrap in the blanket to kasih suam dia. Yeah, just like normal, but don't under the aircon or under the fan and kasih angin dia begitu. Yeah. Alright, very good. Alright, thank you Billy. Yes, Vika.
Apa yang saya paling penting lah, lebih baik buat sesuatu daripada tengok saja.
Do something rather than don't do anything.
Yes.
Okay, do what?
The first aid.
Okay. Alright, give me one example.
The CPR and chest thrust.
For choking.
Yeah.
Yeah, for choking baby. Yeah. Okay, very good. Yes, is my man. Yes.
I learned how to manage the safety of the infant if there's any problem at all. Such as choking.
Okay.
I learned the basic. That's the important thing for me to learn.
Alright. So how do you, if got baby choking, then what do you do? With what? You say choking, right? So if I got baby that is choking, yang sedang, what do you do?
I do the what do we call the back blow and the chest thrust.
Back blow, chest thrust. Okay, and
Continuous
okay, then the kepala.
on a steady.
Okay, very good. Alright, give us a round of applause. Yay! Alright, so just to recap, we'll just quickly go through the learning outcomes for today. So, okay, so at the end of the session, okay, so everyone read this together, Mia. 1, 2, 3.
Identify common infant medical emergencies and injuries.
Alright, so what are the common infant medical emergencies that we talk about?
Choking,
Choking,
burns,
okay, orang lain, kan? Bleeding, falling, drowning, fever, fever fits. Yeah, fever fits. Okay? Alright. Number 2. Everything together. 1, 2, 3.
apply appropriate steps confidently and calmly during emergencies.
Okay. So we learn about this one, especially for fever. Okay, refresher lah. Refresher. Very quick go through Okay. Fever, what do we do?
Sponge,
Sponge. Okay, is what do we do? Fever.
Syrup. The medicine syrup.
Medicine syrup. Apa medicine?
Paracetamol.
Paracetamol. Okay. Shika?
Oh,
See doctor. That's what?
Itu.
Something else. Huh? Cool fever. Okay. Yes. Check temperature. Okay, very good, very good. There's also very high fever. If you're there, you can kasih masuk. Okay, tu. Okay. Alright. How about the fits? Kalau ada fit, what do you do? Start from here. The baby fits. What about? How do you do the baby fits? Okay, that's it.
hold in proper position so that whatever the market can be muncul
Yeah.
kan.
So lead to one side, begitu. So kalau ada muntah, jangan keluar. Alright, or the vomit, or the meal, or the food come out. Okay, what else? Picture is
Safe.
safe. Okay. Ika, and then we need to watch the
Time, not more than 5 minutes.
no more than 5 minutes. Alright? Najwa?
Pas dia sudah kena kok pergi ke dokter.
See doctor. Okay, very good. Dr. Manis ready?
Ah, dan jangan don't put your finger dia bilang.
Don't put finger, don't put anything in the mouth. Okay, very good. Okay, so just now, okay, we talked about that. Now we talk about the first aid. Apa lagi? Yang falling. Okay, fall down. Okay, what do you do? Pak. And then got bleeding.
Oh.
What do you do when you got bleeding?
Check injury and take cloth and hold until bleeding stops.
Take cloth. How long is
10 minutes.
10 minutes. Okay. So if don't stop, what do you do? If the bleeding not stop,
Keep lah.
okay, keep it there. But alright, and then
Buat juga.
okay, that means if bleeding not stop, then put back lah. Okay, then bawa pergi
Jumpa
jumpa doktor. Alright. Then at the same time, of course, on the head, you also need to watch out lah for any warning sign. Because with head kan, takut dia you cause the what we call as the brain concussion. That means the brain will like a little bit of shake a bit. Then the baby will like vomiting, or pingsan, or the different the behavior not the same, don't want to eat, then cry not well. As long as a parent you see the baby like something not right like that, bring to see doctor. Okay, that is for the right. How about burns? Asal panggil lah. What do you do for burns?
letak di air yang mengalir.
Okay, how long?
Jadi
20 minutes. 20 minutes lah. Kita push for 20 minutes. Okay, don't like 5 minutes. Oh, okay, okay, sudah. Alright. Okay. Then what are things that you cannot use during if you got burn? Jangan apa?
No, don't put any home remedies.
Don't put home remedy, Colgate, anything. Alright? Of course, after it's well already, let's say you after 20 minutes, you can put a bit of like lotion. You can put if got wound, you can put like the yellow lotion and then things like that. You can do that. Alright? If let's say satu badan, what do you do?
Take off all the clothes.
Take out all the clothes, and then after that,
Go to the doctor.
go see the doctor, go ambulance. Alright? Very good. Okay, choking. Alright, so choking. Alright, number 3, everybody together. 1, 2, 3.
Demonstrate correct choking relief techniques for infants.
Okay, so what do we learn about choking? Got how many types of choking?
2 times.
2 types, which is
Conscious and
Unconscious.
conscious and causes. Sedar tak sedar. Alright? But before that, got 2 types of obstruction. That means yang block. Got 2 types. Right? One is separuh, one is
Full.
full. Which one is dangerous?
Food.
Full. Okay. If separuh, what do you do? Okay. If separuh, yeah, if half, you don't do the handling, you don't do the press, you just ask them to cough. You can pat on the back with it. Yes. Alright? Sorry,
Is that harder?
Huh?
Is that harder?
Oh, no, I didn't do it actually.
That was hard.
Okay. Yeah. So if it's full block, if it's conscious, for baby, first thing you need to do is
To the head down.
put the
head down.
head down. Okay, put the head down, and then after that
Sit down.
we do the
Final check.
after head down, then apa tu Pak? Sit down and then
Turn the baby over.
we do the let go. How many times?
5.
5 times. How do you hold it?
Wrist.
With the
Heel.
with heel.
Heel.
Wrist sini bukan heel. Okay, between the shoulders. Okay, then we turn back and we do the
Chest thrust.
chest thrust. Where do you put?
In between the nipples.
You have got how many finger?
2.
2 finger. Okay. do lah. Kind of fingernails well. Alright, ikut cerita dalam. Alright. So you repeat until
The baby cry.
baby cry or apa? Or underground or what?
Oh,
Sampai
tidak sedar.
Or tak sedar.
Yeah.
Yeah. Actually, if baby is awake, I mean still conscious and you're doing the choking, you don't have to call ambulance yet. You call ambulance for your baby, tak sedar. Okay, because as long as it's still awake, you just keep doing, do sampai dia keluar. Then focus on doing. Don't waste time to call ambulance. Not yet. Okay, so then you don't also like rush him to the hospital. That's why you do first aid. Then you do pusing sampai dia keluar until they tak sedar. Then only you call the ambulance. Alright, when you do the CPR thing. Okay. Alright, very good. So we did also talk about correct CPR technique. Okay, so the purpose, why do we do CPR? Make sure got
Brain.
itu
Oxygen.
oksigen
into the brain. Because how long can the brain survive without oxygen? 4 minutes. So how do you make sure got blood, got oxygen go to the brain? We need to do CPR. You need to do compression lah, yang penting. Okay, so what are the steps? The 5 letter to D, R, C, A, D. D stands for danger. R stands for response. C stands for compression. A stands for B stands for breathing. So what's the cycle? How many time compression? How many time breathing?
30
30
compression.
to 2. Okay. How many time compression per minute? 100 to 120. Guna lagu apa? Pandai tak surah? Alright. Okay, 130. Make sure that one is done well. Okay, then we do the breathing. What sampai bila? We do until when? Do CPR until we recover or ambulance come or help arrive. Okay, don't stop sendiri ya. Okay, so there is the. Hope you will learn something today from today's training. So nanti I'll send out the feedback form. Okay, please fill up honestly. We are looking for your feedback. If anything you like to improve yourself, and also if this training you think is good, please say it's good so that we can invite more people to come and join this training as well. Okay, so alright, nanti ada presentation of certificate. Okay, give yourself congratulations, small pass assessment. Tadi choking, all the baby also cry, awake, and then the CPR as well. Okay, all did very well. Okay, and last but not least, if anything, please contact me. This is my number. Alright, this is my number. This is my social media. This is my link tree. You can scan this. My name is Dr. Jeremy. Thank you and see you again. Alright, thank you. High five. High five. Come.
Thank you.
Alright, thank you. Thank you. Yeah. Thank you.
That's not
Okay.